So, how do you even begin to fix a healthcare system that serves over a billion people? I mean, a system that is under just immense, constant pressure. It's got to be one of the biggest challenges facing India today. But what if the answer wasn't to just copy and paste a foreign model? What if it was to build a new, smarter one from the ground up, using the pieces that are already there? Well, that's exactly what we're going to dive into. A really innovative blueprint designed to do just that.
All right, so here's how we're going to break this down. First, we'll look at the sheer scale of the challenge and, why you can't just plug in a model from somewhere else. Then, we're going to get into the nitty-gritty of this new blueprint. It's called the Indian Model of Integrated Healthcare. We'll see how it's supposed to work, and finally, look at the path it could pave for better care for everyone.
Okay, so to really get why a new model isn't just a nice to have, but is absolutely critical, we have to start with the current state of play. We really need to look at the numbers, the hard facts that show just how much strain India's healthcare system is under right now. And wow, the gap between where the system is and where it needs to be is it's stark. Take a really key health indicator, right? The infant mortality rate. In India, it's 25.5 for every 1,000 births. Now compare that to the average for OECD nations, which is 4.1. That difference, that's not just a statistic on a page, it's a massive signal that the system is really struggling to deliver the quality of care that people need. And when you dig a little deeper, you can see exactly where the stress points are. It all starts with funding, just 2.1% of GDP. And that has a direct knock-on effect, right? It leads to a shortage of doctors, a lack of beds. And what happens then? Well, it forces patients to shoulder the financial burden themselves, with over half, think about that, half, of the costs coming straight out of their own pockets. In the worst cases, all of this leads to some truly tragic outcomes. It is, without a doubt, a system cracking under pressure.
So you might be thinking, okay, if the system is under this much strain, why not just grab a model that works in another country and, implement it? Well, as it turns out, it's just not that simple. The ideal that everyone is chasing is this thing called integrated care. And really, the best way to think of it is like this. A patient's journey, from their local clinic to a big hospital and all the way back home again, should be one smooth, connected path. No gaps, no having to start over at every turn, just the right care at the right time, every single time. And this right here, this is the core of the problem. The models that have been successful in other countries, they just don't fit India's reality. The individual models, way too expensive. The group-based models, man, they'd require a complete top-to-bottom system overhaul. And those big population-based models, they're mostly designed for private insurance-driven systems, not a public one that's working with limited resources. It's the classic square peg in a round hole problem. Okay, so this brings us to the proposed solution, one that cleverly sidesteps all these problems. It's a homegrown model called the Indian Model of Integrated Healthcare, or IMIH for short. And the genius of it is that it's designed specifically to work with what's already on the ground. This quote really captures the whole philosophy behind it. The IMIH isn't about some radical tear everything down and start over plan. No, the smart approach here is to work with the existing three-tier system of care. The goal isn't to replace what's there, but to make it all work together, to integrate it and optimize it. And it works on three distinct but totally interconnected levels. So you've got the macro level, which is all about managing the flow across the entire system. Then there's the meso level, which is about smartly distributing patients between different hospitals. And finally, you get down to the micro level, which is about completely redesigning the patient experience inside a single clinic or hospital. So what does this actually look like in practice for a patient? Come on, let's take a journey through this new reimagined system, from the biggest, broadest view right down to the smallest detail. All right, at the top, the macro level, the entire system revolves around this new concept, the Central Gateway Control Room, or CGCR. You can pretty much think of it as the central nervous system. All the primary care centers feed information into these control rooms, and they, in turn, manage the flow of patients, directing them to exactly the right level of care. Yeah, it's basically air traffic control for patients. I mean, think about it. Just like a control tower prevents massive log jams at airports, the CGCR prevents overcrowding at major hospitals. It has a live, system-wide view, it knows exactly where beds are free, and it can route patients to the most appropriate facility in real time. The end result? A much smoother, more efficient flow for everyone.
Okay, now let's zoom into the meso level. Once that CGRC sends a patient to a secondary care facility, it uses this really simple but super effective bucket overflow method. It just directs patients to the first available hospital until it reaches capacity, and then boom, it automatically starts filling the next one, and so on, right down the line.
And this just completely eliminates the chaos of the old way of doing things. Instead of patients basically guessing where to go and hoping for the best, you have a truly smart distribution system. It ensures that all the hospitals are used effectively, which prevents one from getting totally overwhelmed while another one sits half empty. It's just logical, controlled, and way, way more efficient. And finally, let's go all the way down to the micro level, where the actual patient experience inside the hospital gets a complete redesign. Imagine a one-stop shop designed in these concentric circles. You start on the outer ring for things like labs and pharmacies, then you move to the middle ring for a general screening, and finally you end up in the inner core for your specialist appointment. They even use a clever 3-door system for the clinics, 1 door in, 1 door out, and a third for direct specialist access, which creates this smooth, one-way flow that really minimizes confusion and, just running around in circles. All right, so with all these pieces, macro, meso, and micro, fitting together, what's the big picture here? Let's take a step back and see how this all builds towards a better, more accessible, and more affordable healthcare system. The impact of a model like this is felt on both sides of the equation. For patients, it means a less stressful, much more coordinated journey. It means better access to the right doctors and, crucially, lower out-of-pocket costs. And for the healthcare staff, it means less wasted time, clearer communication, and having the full picture of a patient's health history right at their fingertips. It's truly a win-win. So this isn't just about making small tweaks here and there. The IMIH model really acts as a bridge. By smartly using the resources that already exist, it creates a clear and economically viable pathway from the system we have today to that ultimate goal of universal health coverage. It makes that huge ambition it feels genuinely achievable. So where does this leave us? Well, the IMIH is this powerful, custom-built blueprint for India. The logic is absolutely solid, and the potential is immense. But, and this is the big but, the biggest hurdle is still ahead. You see, a plan on paper is one thing, but implementation is everything. Rewiring a system this massive is going to require incredible political will and administrative drive to turn this brilliant vision into a reality for over 1 billion people.